Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's discuss few more mock questions from the CPC examination. So if you are new to the channel friends, please subscribe, please support me, and let's move to the questions one by one. So let's move to the first question. A 2-year-old pulls a pot of hot water off the stove and it splashes on his face and arms. When examined, the infant has first-degree burns on his lower face and second-degree burns on both arms. The physician treats the burn on the face approximately 3% of the total area with silvadene dressing. For the second-degree burns, both arms, approximately 11% TBSA. TBSA means total body surface area. Have no infection and the blisters are intact. The burn is cleansed and silvadene dressing is applied. What CPT and ICD-10 codes are reported? So here this question is totally related to burns. You will definitely get a question from burns. So here first degree and second degree burns both are there. First degree burns on lower face and second degree burns on both arms. Okay. What is mentioned here on the face. Face is the first degree burns with TBSA of 3% and for the second degree burns TBSA of 11%. So anyway, let's move to the ICD codes one by one. What is the first code? T22.20XA. So you can open the ICD code book, go to T codes, take T22.20. You will not get the exact code as mentioned in the options. Okay, T22 point. If you can open the ICD code book, you will get the code T22.20. Up to 20 only you will get it. Total ICD code consists of 7 digits. So what does this X and A represents? X is the placeholder and A means initial encounter. Why this is called as initial encounter? Because the physician has done the dressing and it's mentioned there that no infection and the blisters are intact. Burn is cleansed and silvadene dressing is applied. So there is no further referral or further complications. Nothing is mentioned in the question. So it means, and this is the initial encounter, like first visit of the patient, right? For the burn injury. This is the first visit. So this will be the initial encounter. So that's why on the 7th digit, the character will be A. So if 7th place is A, which means initial encounter. Okay. What does the other remaining places, the remaining empty characters, you have to mark it as X, which represents the placeholder. That's how this ICD code came. T22.20XA. If you open ICD book, you will get it as T22.20 only. Okay. ICD code T22.20. In the ICD code book, you will get it as burn of second degree of shoulder and upper limb except wrist and hand, unspecified site. Second degree of shoulder and upper limb. We have second degree both arms. So this is upper limb. So this code should be there. What is T20.10XA? What is T20.10XA? Go to T20.10. T20.10 means burn of first degree of head, face and neck, unspecified site. This is also there, right? First degree of face. So T20.10XA is also, that code also should be there. Now the next one is X code. What does this X code represents? X11.10 8XXA, X11.8XXA. Go to ICD code book, take X11.8XXA. Here it is mentioned. What is X11.8XXA? You will get in the book as X11.8 only. The other two are placeholders. XX are placeholders and A represents the initial encounter. So what is the description? Contact with other hot tap water. Here it is not mentioned tap water. Here it is mentioned a pot of hot water only. Okay. But in this code it represents contact with hot tap water. So this code will not be there. We can go to the next X code. Let's try with all the X codes. Anyway, we got the T codes. We got both the T codes, right? T22.20XA and T20.10XA. So we can go to we can find out the X codes, because this hot water also we have to code like how it happened. So what is the next one? X12.XXXA. What is X12.XXXA? It represents contact with other hot fluids, initial encounter. Yeah. Out of the 2 X codes, only 2 X codes are mentioned among 4 options. So out of the 2 X codes, the first one is tap water, but in our question, the X11.8XXA represents the tap water, but in our question, there is no tap water mentioned. It's just pot of hot water. So the accurate option code will be the next one, X12.XXXA, which represents contact with other hot fluids. Okay, so our X code should be that one, X12.XXXA. So we got 2 T codes and the X code, T22.20XA, T20.10XA and X12.XXXA, which is there in option D, right? If you want, you can just search for the options, the codes mentioned in options B and C, T21.22XA, T20, but there will be some discrepancies. So I'm not explaining everything, okay, because you will also get bored. The video length will be more. You will feel more bored. You can just try for all those codes. But anyway, since we got the correct T codes initially, we can go with it. Okay, option. So the correct ICD code options are there in option D. Now let's move to let's check the CPT codes also. What is the first one? The first CPT code in option D, 16030. What is 16030 represents? You can open the CPT code book. 16030 represents dressings and or debridement of partial thickness burns large, more than one extremity, greater than 10%. We have to code for 2 burns, right? One is with 11% TBSA and the other is 3% TBSA. The first one, the 3% represents the face and the other one is the other side, arms. Both are in different area, different site. So you have to code it separately. So which one should be coded first? The one with more burn, 11% burn. So that should be coded first. So 16030 represents dressing and or debridement of partial thickness burns large, greater than 10%. So that should be there. And what is 16000? Initial treatment, first degree burn when no more than local treatment is applied. Just first degree burn treatment, we are mentioning it as like we will use the code 16000 along with modifier 59. Why modifier 59? It's a distinct procedural service, right? Because one is in arm and one is in face. So distinct procedural service. So we will append modifier 59. Okay, so this is how we need to check the burn codes. If the TBSA is mentioned, or if there are more than one site, you have to first code for the more affected area first. CPT code. The first CPT code should be more affected area, and then you have to code the next one, the next code. The next, like second degree here, first degree and second degree are there, right? So which is more severity? Second degree. So you have to code for the second degree, and then you have to code for the first degree. Since it's a different site, you have to append modifier 59. We will not append modifier 59 to the first code. We will append it to the secondary code. Okay. So here in this question, our answer will be option D as discussed. Okay. Now moving on to the second question. A 3-year-old is brought into the ER crying. He cannot bend his left arm after his elder brother pulled it while they were roughhousing. That's a sort of game. The physician looks at the X-ray and makes a diagnosis of dislocated nursemaid's elbow. The ER physician reduces the elbow successfully. The patient is able to move his arm again. The patient is referred to an orthopedist for follow-up care. What CPT and ICD-10 CM codes should be reported? So here, the patient is brought to the emergency. What they were doing, the patient is 3-year-old boy. He was playing with his brother, roughhousing. So after the physician looks the X-ray and makes a diagnosis as nursemaid elbow. Nursemaid elbow is the diagnosis. Okay. So you have to code for the nursemaid elbow first. Let's look into the options one by one. The first ICD code S53.032A. What is S53.032A? Go to ICD book, take S53. You will get S53.032. Okay, and A represents the initial encounter. Since here all the other six digits are occupied, we don't have to put the placeholder X. So S53.032A represents nursemaid's elbow, left elbow. That is our diagnosis. Left elbow, left arm. It's written there, right? He cannot bend his left arm. So this is on the left. So nursemaid's elbow, left elbow. That should be the code. If you want, you can check for the other S codes also. What is S51.009A in option C? S51.009A represents unspecified open wound of unspecified elbow. No, that should not be the code. What is the last one? S53.006A. Unspecified dislocation of unspecified radial head. That's also not the correct one. So we already got the correct S code, S53.032A, which is in option A and B. Now, what is the next code? Y93.83. Y93.83 represents activity roughhousing and horseplay. Yeah, this is roughhousing. Okay, the activity, how it happened, roughhousing. What is Y93.83A? That is an incorrect code, right? 83A in option B. That is an incorrect code because only 6 digits are there. And also this roughhousing activities and all, we will not put initial encounter, right? We will put only initial, subsequent and sequela, all encounters in the injury part, injury code only. So option B also wrong. So our answer will be option A. We got the correct ICD codes. So definitely our answer will be option A, but still we have to look for the CPT code also, 24640. What is 24640? If you can open CPT code book, 24640 represents closed treatment of radial head subluxation in child nursemaid elbow with manipulation, which is our correct answer. And along with modifier 54. Why is it mentioned here? We have only one CPT code. That's why we have appended the modifier 54 to that CPT code. What is modifier 54? 54 modifier represents if the physician is being referred to another provider for a follow-up care. after all or part of the post-operative care. Here already the physician has done, reduces the elbow successfully, close treatment has been done already, and then for as a follow-up care, the patient is being referred to an orthopedist. So if like that, after a post-operative care, if the doctor is referring the patient to a specialist as a follow-up check, then we will append modifier 54. Okay, so our answer will be option A, 24640 with modifier 54, and the ICD code for nurse made elbow, and the ICD code for rough housing. Now moving on to the third question. A 45-year-old male with stage 3 non-Hodgkin's lymphoma showed pathologic cervical nodes on the PET scan. A biopsy was recommended. A supraclavicular incision was made, deepened down through the platysmal muscle. Ligation of the external jugular vein was performed, and deep to the structure, numerous large nodes, approximately 3 to 3.5 cm in greatest dimension, were seen. Once elevated, the hilar aspect of one of the nodes was serially clipped with hemoclips to remove it. What code would accurately report this procedure? So this is only a CPT code that we need to check. Let's directly move to the options one by one. What is the first code represents? 38720. 38720 represents cervical lymphadenectomy complete. If you open CPT code book, go to 38720. Cervical lymphadenectomy complete. This is not cervical lymphadenectomy. Nowhere it's mentioned lymphadenectomy. Okay. What is option B? 38520. 38520 represents biopsy or excision of lymph nodes, open, deep cervical nodes with excision scalene fat pad. Open, deep cervical nodes with excision scalene fat pad. Nothing is mentioned in the question about excision of scalene fat pad. So this is also not the answer. What is option C? 21550. 21550 represents biopsy of soft tissue of neck or thorax. No. Here biopsy is done, but what type of biopsy is done? That is what is important. Okay. Let's go to option D, 38510. 38510 represents biopsy or excision of lymph nodes, open, deep cervical nodes. Yes, we want only till that. If you can compare option B and D, 38520 and 38510. 38510 represents biopsy or excision of lymph nodes, open, deep cervical nodes. That is what we want. But in option B, it's additional excision scalene fat pad is there, which is not mentioned in the question. We have only the procedure biopsy, okay, or excision of lymph nodes. Lymphoma. See, here it's mentioned in the question, lymphoma showed pathologic cervical nodes. So that cervical nodes was excised, was biopsied. Biopsy was recommended. The remaining all, it is just mentioning how the procedure is being done. Okay. So biopsy of cervical nodes. That is what we need. Open deep cervical nodes, which is there in CPT code 38510. So our correct answer will be option D, 38510. Moving on to the fourth question. The patient is a 58-year-old white male, 1 month status post pneumonectomy. He had a post pneumonectomy empyema treated with a tunneled cup pleural catheter, which has been draining the cavity for 1 month with clear drainage. He has had no evidence of a block or pleural fistula. Therefore, a planned return to surgery results in the removal of the catheter. What is the correct CPT code? Here also we have to mark the correct CPT code. Here also initially there are so many stories mentioned, but what is the final code that we have to code? Planned return to surgery results in the removal of catheter. So removal of catheter is the code that we need to code. Okay. Anyway, let's move to the CPT codes options one by one. Go to first option, take code 32550. If you are feeling that I'm doing little fast, you can just pause the video and then open the book. Okay, then you can play it again. So first option 32550. What is 32550 represents? Insertion of indwelling tunneled pleural catheter with the cuff. That is there, but little more additional that have to be added. What is modifier 58? 58 modifier represents related procedure performed during the post-operative period of first procedure by the same physician. What is option B 32035? Represents thoracostomy with ribs resection. No, this is not thoracostomy. What is option C 32036? Thoracostomy with open flap drainage. Again thoracostomy. No. Our procedure is removal of catheter. So what is option D 32552? Removal of indwelling tunneled pleural catheter with the cuff. Yes. Removal of indwelling catheter. What is 32550? Option A, that is insertion of indwelling catheter. I was telling that it could be option A, but no, that was insertion. But in our question, we have to code for the removal. So removal code is there in option D 32552 with modifier 58. Modifier 58 represents related procedure, like initially the procedure was done and then a planned return to the surgery was there by the same physician. So the same physician is removing the catheter again, doing the procedure again. So in that case, we will use the modifier 58. Okay. So our answer will be option D 32552 with modifier 58. Let's look into one more question. The patient is a 64-year-old female who is undergoing a removal of a previously implanted Medtronic pain pump and catheter due to a possible infection. The back was incised, dissection was carried down to the previously placed catheter. There was evidence of infection with some fat necrosis in which cultures were taken. The intrathecal portion of the catheter was removed. Next, the pump pocket was opened with evidence of seroma. The pump was dissected from the anterior fascia. A 7 mm blade drain was placed in the pump pocket through a stab incision and secured to the skin with interrupted proline. The pump pocket was copiously irrigated with saline and closed in 2 layers. What are the CPT and ICD-10 CM codes for this procedure? So here what procedure is being done? What will be the diagnosis? There is an infection, right? Infection of, previously implanted pump and catheter. Under removal of previously implanted pump and catheter is a procedure due to an infection. So anyway, let's move to that. Anyway, one ICD code is there in all the options. Let's look into the ICD codes one by one. What is the first code? T84.81XA. What is T84.81XA represents? Embolism due to internal orthopedic prosthetic devices, implants and grafts. Embolism, no. Here it is mentioned infection. So that's not the answer. What is second one? T81.40XA. Infection following a procedure, unspecified. It's mentioned unspecified. This is not unspecified. This is an infection following what procedure? Infection from the previously inserted pump and catheter. That's what we want. What is the next one? T85.79XA. T85.79XA. What does that represent? T85.79XA represents infection and inflammatory reaction due to other internal prosthetic devices, implants and grafts. Yes, this is an infection from implants and grafts, right? So this should be this is our correct ICD code. Infection and inflammatory reaction due to other internal prosthetic devices, implants and grafts. T85.79XA. Still, let's look into the last option, T88.8XXA. Other specified complications of surgical and medical care. No, we already got the proper ICD code, which is there in option C, T85.79XA. Let's look into the CPT code also. What is 62365? In option C, 62365 represents removal of subcutaneous reservoir or pump previously implanted for intrathecal or epidural infusion. Yes. And what is 62355? 62355 represents removal of previously implanted intrathecal or epidural catheter. Yes, removal of catheter, previously implanted catheter. So our both the CPT codes are correct in option C. Along with modifier 51. Why 51? 51 modifier represents multiple procedure. See, in the fourth line it's mentioned the intrathecal portion of the catheter was removed. So intrathecal portion of catheter was removed is the first procedure, that is in option, that is in code 62365. Next, the pump pocket was opened with evidence of seroma. Pump was dissected. Pump pocket was placed through a strap. Pump pocket was copiously irrigated with saline and closed in 2 layers. And then this implant removal, which is mentioned in the first sentence. Removal of a previously implanted pump, that also we have to mention, 62355 with modifier 51, because it's a multiple procedure. Both the one is previously implanted, catheter was removed, and the other one is intrathecal portion of catheter was removed. Okay, so both codes we should mention along with our ICD code. Infection, because the patient was having infection from this previously implanted device, catheter. So our answer will be option C. Okay, you can just go through you can just repeat this question again and again. It's little bit confusing, but if you can repeatedly check this, like answer this question, you will come to know. If you have any queries, you can mark in the comments. Okay, so here the answer is option C. So friends, that's all for this episode. Few more questions from the previously year examinations. I'll be coming back with few more guidelines and more questions. Thank you so much friends for supporting me. If you like the video, please like and share, and if you are new to the channel, please subscribe to my channel and please press the bell icon so that you will not miss any new videos. So stay tuned for more questions. Thank you so much. Bye.